Welcome to Exploring Places Unknown. I'm your host, Trey, and today I am really excited and honored to have Eileen Kopsaftis, a dedicated advocate for health and wellness. With over 30 years as a physical therapist, she's seen how beliefs about aging and pain shape our lives. Eileen is also the best-selling author of Pain Culprits and Aging Culprits, where she dispels myths about chronic pain and aging. Her unique approach combines practical science-based strategies in movement and nutrition, helping people reclaim strength and independence at any age. So join us today as we look into her story and some of the things she's doing in the wellness space. Eileen, welcome to the podcast.
Thank you, Trey. I'm excited to be here and really looking forward to sharing good things that unfortunately are not really well known in the mainstream world, but they should be. So thank you for the work you're doing to get the information out there.
Absolutely. You've been doing this for 30 years. That's pretty much how long I've been alive. So you've been doing this for a long time and you have a wealth of experience and knowledge. So I love having people like you on the show who can talk about what you're doing and talk about and dispel some of the myths basically in the wellness space. So welcome to the show and, Happy New Year.
Yes. Happy New Year.
And, you know this better than anyone. Right around that New Year time, everyone gets that itch to want to try to start new things. So I love that you're coming on right now so we can talk about some of the things going on in the wellness space. So one of the places I like to begin is kind of bring us into the journey of how you started doing this and how you became this person that you are today.
Okay. Well, at my age, that could take a long description time, but I'll try to do bullet points. So when I was really little, I wanted to be a doctor because I've always wanted to help people. I've always been that, champion for the underdog kind of person. That's just it's in my DNA. So I wanted to be a doctor, but then when I was ready to go to college, I realized I didn't really agree with the medical model. I have nothing against doctors. It's the medical model of, medically manipulating those blood biomarkers, which is basically just treating symptoms, but not really impacting the cause of those symptoms. And so it's not really restoring health. And a lot of people don't realize that a lot of the medications that we take, while it gives us great blood work and it makes the doctor happy and we feel secure, a lot of people end up having some very serious life-altering, if not life-ending events while on those medications because they don't reduce the risk of having the events because it's not addressing the underlying cause. So I realized, okay, I don't really want to go into the medical profession. That's the way it's practiced here in this country. And so I have always been really fascinated with nutrition. I used to study a nutrition almanac.
Wow.
Where I would just look at it and then I'd have coworkers say, oh, well, what should I do for this? And what should I do for that? Fun stuff. And so I realized, okay, maybe I'll go into nutrition. And then back when I was looking at school, nutrition was based on the 4 food groups. I didn't agree with any of that either. And if you disagree with your professors, you tend to not pass.
Yeah, that's true.
So I realized, okay, maybe this isn't for me. And they happened to have the physical therapy program in the catalog. And I've always been fascinated with the workings of the human body. So I said, I think this is it. And the funny part is every time I called the college to ask some questions about the program, it was like they were trying to talk me out of it. This is a very challenging program. This is very challenging. It was like they were trying to say, maybe this isn't for you. And of course, when somebody uses the word challenge, I don't know if it's my Irish German background or not, but I just kind of get the bullhorns on and say, I'm going to get this. So that's what I did. I ended up going into the PT world. And then fast forward about 20 years or a little bit less, after being in my profession, I came across the Wellness Forum Institute for Health Studies, who started a nutrition educator diploma program that is not industry funded. It's completely science data based. And so there's no bias, there's no conflict of interest. And so now I have my diploma in nutrition education. So I've kind of been able to cover both worlds. And then right out the gate from earning my degree, well, before I even finished college for PT, there was a speaker. Her name was Mary Chew. Well, it is Mary Chew. She's still around. Chew. Her husband happens to be English, I believe. So everybody thinks that maybe she's Asian, but she's not. She's this tiny little Italian woman who became my closest friend for years, and we took lots of coursework together. But she spoke at the college, and she spoke on manual work and how effective it was. And when I graduated, before I got my license, I had to do clinicals. And one of the clinicals I did happened to be in an outpatient PT clinic owned by a couple of women. They were business partners, and they took a course of Mary's, and they were raving at the effect it had on their patients. And they told me, as soon as you get your license, you have to take her course. So, of course, I did. And Mary and I became good friends. We took tons of coursework together because I wanted her to save me from wasting resources and time on coursework that didn't really help people. And Mary was really good at what she did. She had like a 3-week waiting list. Doctors would send people to her, only to her. And so she became a good friend, a mentor, and I learned tons. The first half of my profession was all based on manual skills. And I wouldn't give somebody exercise unless I knew they were properly aligned and things were correct. And there were so many chronic pains that were able to be resolved or alleviated by very simple manual techniques. And we're not talking snapping and cracking. I'm not picking on a specific profession, but it's more of a mobilization, not a manipulation. And so very gentle muscle energy technique. It's been around for a really long time. Strain and counter strain, which has also been around for a really long time. Myofascial release, craniosacral release, Brian Mulligan's mobilization with movement. These methods, these techniques are profoundly effective at restoring the biomechanics of the body, the joint function, how the body is aligned and working. I wasn't really big on exercise because if something hurts, telling somebody to exercise it isn't necessarily going to fix it. It's kind of like if your tires are out of alignment on your car and you give them more miles to drive, that's not going to fix the tire. It's only going to cause more harm. And after I was in my profession for about 15 years, doing all this manual work, I was introduced to something called applied functional science, which is taught by the Gray Institute, which was founded by Dr. Gary Gray. And he is one of the most brilliant minds that I have ever come across when it comes to human movement. And he's actually nicknamed the father of function.
Wow.
And I mean, he's just, if you hear him talk, you're just kind of like this and you just, I'm a groupie. I never want to stop hearing him talk, but I've taken their coursework. I've taken their most advanced coursework, which is a fellowship in applied functional science through the GIFT program, which is Gray Institute Functional Transformation. So I'm just sharing all this in case anybody wants to check it out because I highly recommend it. But it completely transformed the way that I work with people now, because it was that holy grail of movement that was missing from my knowledge. Because I didn't, I worked with colleagues who, if somebody was a knee, they all did these exercises. If somebody was a back, they all did those exercises. If somebody was a neck, you gave them range of motion and you did modalities like ultrasound or hot pack. And I had one guy, he came in with neck pain. Just a quick little story, because this is important for people to hear how everything's connected before I finish my bullet point, which I think got a little bit long today.
No, you're fine.
But this guy came in and he got on my schedule because his therapist had gone on vacation and he'd had about 8 or 9 treatments and it was all for neck pain. So it was a little bit of massage, some range of motion, some ultrasound, some hot pack, that kind of thing. And when I'm looking through the notes, I'm not seeing anything change. That he wasn't reporting any change. And of course, I asked him and he said, no, the symptoms were the same. And I said, well, do you mind if we do something different? Because I wasn't impressed with the treatment he'd been receiving, but I didn't want to sound unprofessional and any of that. So I just said, can we look to see where the cause of this might be coming from? And he was very happy to do that. And I looked at his low back, because the spine is one piece of anatomy, even though we break it up into cervical, thoracic, lumbar, it's all attached. And so the low back can certainly impact the neck. And I looked at his low back. I found a little something, but it wasn't much. And I said, when do you get your neck pain? And he said, when he took his morning walks. And by the end of his morning walk, he had neck pain. He had a headache. He didn't want to give up walking. He loved it, but he wanted the neck pain to stop. And because I understand how everything's connected, I said, well, have you ever sprained your ankles? And he said, constantly in college, because he was in sports. And so when I looked at his ankles, healthy ankle function is there's something called dorsiflexion where it comes up. I've actually got my little foot guy here, which I can show. So dorsiflexion is when the toes come up and the heel stays down. And you need at least 10 to maybe 30 degrees of dorsiflexion for healthy function when you're walking and running and sports and all. And he was kind of stuck at 0 on one. He had no dorsiflexion at all. And the other one, he was stuck a little bit in the opposite motion, which is plantar flexion. He was like a -5. And
Wow.
so I did some mobilization to the joints, taught him how to do a very special way of lengthening the calf muscles because they had shortened over the years. And he never had to come back. His neck pain was gone, no more headaches. He could walk all he wanted in the morning with no symptoms up here. But they were treating the victim. They weren't treating the culprit, which was the ankles. So, in my book, Pain Culprits, I go through a lot of the connections that people don't realize how important it is to understand because we're whole people, we're not parts.
Yeah,
And
that's very interesting.
yeah,
Go ahead.
yeah. So to get back to my history here. So when I found this movement and I realized this is what I've been missing, it's the Holy Grail. I have started now really focusing on teaching people how to assess their own 3-plane function, which they can do in like 20 minutes, figure out where their culprits are, and then know where to focus their time and attention instead of beating up the victim. And so I could not be more fulfilled in what I do because I feel that, the Gray Institute and 15 years prior to that with all the manual coursework, and I've worked in pretty much every setting there is: hospital acute care, home care, nursing home settings, long-term rehab, and orthopedic outpatient. And I've even worked with teenage athletes. So I'm not saying I know it all, but I feel like I've seen it all. And so I can, I really have a good understanding of what entails what. And so now I couldn't be more fulfilled. I love what I do. I don't feel like it's work. I'll spend 10, 12, 14 hours a day doing what I do. I've been doing long distance consulting, since long before the world shut down, using Zoom, working with people all over the world because I can watch them move. I can teach them what to do and they get better. And so if I think they need somebody local for a manual skill or something, I will recommend that. And I would tell them, you got to find somebody who knows how to do this or do that. But for the most part, when people understand the way the human body was actually designed to move and be trained, it changes everything. It completely alters the trajectory of their future. And unfortunately, most of us are hanging out at the gym, isolating body parts,
Yes.
isolating muscles, creating tendonitis, tendinosis, tendinopathy, wondering why we've got pain, not putting any relationship to what we're doing at the gym or even the exercises we've been taught by mainstream, which many trainers are well-meaning, but slightly misinformed about authentic human movement. So it's been my passion. I've done tons of free events online. I've done 37, I think, free events since August of 2020 online, helped thousands of people to move better. And I'm not going to stop doing what I'm doing. I'm 67. I don't plan on ever retiring. I'm going to do this. I'm going to be at least 112 and be really stinking happy about it.
Yeah.
And I want to see as many people as possible have the same future.
I love what you're doing, how you're able to pinpoint the root cause. I think that's very unique. And you said something earlier that really caught my attention, is that a lot of times medications are prescribed to improve biomarkers. And so with that being said, is your approach more holistic? Do you ever recommend people get medications, or is it just, hey, let's try to work on the functionality of your body
Yeah. So
more than anything?
that's a really good question. You have to be careful because, when I do long-term consulting, I don't consider it physical therapy treatment because I have to be licensed in their state. There's a lot of regulations and rules and things that we have to make sure we comply with, legally and to be professional and responsible. But teaching somebody movement that doesn't require licensure is perfectly fine. Teaching somebody things that don't require licensure is perfectly fine. But I also am able to, because of my nutrition educator diploma, I'm able to work with people in like a health concierge type of way. And it's completely outside the scope of what I do to prescribe anything or even recommend medications or tell people to stop taking them. But what I can do is I can teach them strategies, changes, how to change how they're feeding their body, any potential supplements that would be mostly short term, depending on what's going on, like the microbiome, that kind of thing. Or I've taken herbal medicine, herbal nutrition. I might recommend some herbs. However, they need to work with their prescribing practitioner to change any medications. And I do teach them how to ask the right questions so that they know what to ask. And also, the number one point or focus is to restore health to the point where their body no longer requires the medication. And then the prescribing practitioner can say, oh, your blood pressure is much improved. As a matter of fact, it's getting a little too low. Let's cut back on that blood pressure medication, or let's maybe discontinue it because I don't think you need it anymore. That kind of thing. I've had a lot of people where their doctors have told them, I don't know what you're doing, but keep doing what you're doing, because it's working. And I mean, I had one guy, I teach classes at the local community college, and I was doing these Nourish Away Pain classes and Nourish Your Body for Lifelong Wellbeing classes. And I would literally bring a 4-course meal to the classroom and feed them this food that restores health. And because they were able to taste the food, they're like, oh, I can't wait to go home and make this. If you just handed me this recipe, I would have never made it. I mean, who's going to go home and make spicy lentil soup, or who's going to go home and make barbecue beans and rice? There's no meat in it. And so, but when they taste these foods in the classroom, and I got PowerPoints up and I'm going through for 3 hours, I'm going through these slides as I'm serving them a 4-course meal during the class, including dessert. And they can't wait to go home and make the food. And within a week, 2 weeks, they're seeing their joint pain is better. Their migraines are gone. I mean, the changes in their bodies, those who decide to apply what they're learning in the classroom. And this one guy, I'll never forget it, because I have the food set up on crock pots on a table, and I tell them, please, you will not disrupt me if I'm teaching. Come up and get seconds, come up and get thirds if you want. And I did have a guy come up, he got thirds, and he was worried about diabetes. He was pre-diabetic. His A1C was climbing, and his doctor was concerned. He would literally text me from the supermarket asking me about labels and and I loved it. Some people would say, well, that's a pain. I'm like, no, this guy is taking this so serious. I mean, he's diving in with, and he's going to get well. And his doctor was thrilled with the results that he had from what he was doing, and no longer, pre-diabetics. And he lost weight, and I mean, he was a really happy camper. And I could tell you story after story about this, but it truly is, the human body is so miraculously designed on a cellular level to restore, rebuild, heal, repair, as long as we're doing the right things the right way. The problem is people are confused about what is the right thing, what is the right way. There's so much conflict. When you do an internet search, you're overwhelmed with thousands of different people telling you different things. And now might be a good time to say this. I tell people, if you're confused about what to do and somebody's giving you advice, whether it's your neighbor, your coworker, your colleague, even your doctor, find out how long have they been doing what they're doing based on your specific concern, and how many people have they helped? Because it doesn't matter how many people have they treated.
Yeah, that's good.
How many people have they helped? And, there's a lot of best-selling books out there that are written by MDs. And I don't mean any disrespect, but a lot of those books are written by MDs who are no longer practicing medicine. So they are not applying what they've written in this book to their patient population. And I can tell you, to earn my nutrition educator diploma through the Wellness Forum Institute for Health, I studied under physicians and other healthcare experts who have been helping people get out of pain, eliminate disease, get off meds for 30 or 40 years.
Wow.
So I would say their track record is stellar, and I've seen it work. So, yeah.
So what would you tell the people that are going to listen to this, that it's 2026, it's a new year, and they've been immobile for X amount of years, and they want to start being active? Like, what's your step process to getting them back on a healthy track? What would you normally say to them?
Yes. And that's another, you're really good with these questions, Trey. Um, so obviously it kind of depends because it depends on where they're at. Because I always say every person is unique, like a fingerprint. They've got their own histories, their own body style and size and shape, their own medical conditions, their own maybe trauma history, their own personalities, how they learn, how they interact with other people. I could have 3 people come into the clinic with the same diagnosis, the same symptoms, but need 3 completely different plans of care to resolve their issues because they're each unique. But that doesn't mean that we can't follow general guidelines that are really designed in a way that meets the human body's needs. And so one of the most important things people need to know is that movement is required for life. And I know if it hurts to move, people move less. And unfortunately, the less they move, the less movement they now have available. And so they get stiffer. Their world shrinks in their ability to just navigate life. And so getting started moving is key. And there are some very simple ways to get started moving. Now, the issue again here is we want to be doing 3 planes of motion, which is what the Gray Institute is really good at teaching, and which I now teach to the general public because the Gray Institute only teaches licensed professionals. They don't teach the general population. And so, I got their blessing to go ahead and teach this, not hired by them. I don't work for them. This isn't a program they created, but I based it on what I learned from them. And moving in 3 planes of motion is critical because so often when we exercise, we're only moving in one. For instance, if somebody wants to strengthen their abs, they're going to do sit-ups and crunches and those kind of things. Well, that's shortening the muscles without lengthening them first. So you're kind of shortchanging half the range. And that's only in one plane of motion. It's sagittal plane because we move forward and back. That's sagittal. We move sideways, which is frontal, and we rotate, which is transverse. The abdominals love rotation. It really switches them on. And they work a lot better when you're upright and you're getting them longer by leaning back because that's how they're actually designed to function. I mean, how many people laying on the floor have had to lift 100?
Yeah, not often.
Exactly. So it's not functional. It's not authentic. But how many people have had to lift something heavy up overhead, maybe put it on in an airplane? They got a heavy suitcase, or they're getting something out of the closet and it's heavy and they're lifting it off well, now you've got your abdominals, the front of your body is getting longer and loading, but it's got to have the strength and the control to keep you from falling back and smacking your head open for one thing. And so that's just training the body to lengthen with control and in 3 planes of motion is key. So if somebody's really been sedentary, if they have very impaired motion, I've had people use this to resolve chronic back pain, even if it was like an acute thing. Like one person in my academy reached across the bed and she goes, yeah, I pulled something. And I said, well, do the hip matrix during this meeting and let's see if you don't feel better. Because I'm running a beta program now for people to progress in like 6 months or less. And so during this meeting, she was doing what we call the hip matrix. And a matrix is anything where you move in 3 planes. And basically you're just moving your hips forward and back, and you're moving them side to side and you're turning. And she just did that during the meeting. And she said the pain resolved. I mean, the next morning she woke up and it was like nothing had ever happened. Now, if somebody starts doing that moving and part of that movement causes pain, here's the thing that people need to know: that no pain, no gain thing, that's DOMS. That's delayed onset muscle soreness, which is a specific response to somebody who wants to grow a muscle bigger. And that's not rehab. That's not resolving chronic pain issues. You do not want pain when you're doing movement because your brain will just want to stop you and protect you, but it won't tell you it's doing that. Your brain thinks, oh, I got to help them stop hurting themselves. So say just doing this simple forward and back maybe causes a little pain because those front hips might have locked a little short. And so now when you go forward with your hips, you might feel a pull on your low back and it's not pleasant. So what I tell people is don't force it forward. If it doesn't like it, don't do it. Just put your bottom backward, kind of like if you were telling one of your siblings, go ahead and kick me, kind of thing. And so Just go backward because that feels good, and only go forward as far as feels comfortable. And what'll happen is it's kind of like when a drawer gets stuck, you push it all the way in to get it on track before you pull it out. So you're making it happy doing this, and you're not forcing it to be unhappy doing forward. So just that simple thing can really help people. And then the side to side, it's the same thing. If shifting one way causes some pain, don't do the way it causes pain, do the way it likes. And eventually the body kind of resets itself. You're creating this fluid fill effect, this pumping action that just restores motion. And it's the same thing with rotation. And that can also get the ankles going, because if anybody stands here and does this, they're going to notice, oh, my ankles are working when I go forward and back. My ankles are working when I'm going sideways. My ankles are working when I'm turning. So you're kind of working your body from the ground up by that simple motion. That's probably one of the best ways for people to get started. And then, of course, learn more, access a lot of my free content, my YouTube channel, whatever. So,
I noticed something too, that with society, there's always this big rush, and a lot of times we're trying to get to that finished product or whatever that we want to be at, and we try to rush that process. And so what I notice a lot of times with like physical trainers in the gym, and I'm not talking bad about anybody, I'm like, well, why don't they teach this stuff first, about the functional side of things, about the foundation of the body, before we get into load bearing and deadlifts? I've seen so many people get injured doing stuff who have been sedentary, and they're doing, 200-pound deadlifts, and they haven't done anything, and they pull something. So I love what you're doing and how you're really getting to the root cause of this stuff. It's fascinating.
Yeah. And, I've worked with patients who were injured doing deadlifts. So I know exactly what you're saying. And what I always tell people is you need to have full motion before you start strengthening. If you have limited motion, don't try to get stronger. Get your mobility back, and then we'll earn strength. That's key. And trainers, I've worked with a lot of people consulting who had personal trainers. And I would tell them, whatever it is they're doing with the trainer, make sure you're applying what I'm teaching you with your personal training sessions. And pretty much every one of them, when they shared this with their personal trainer was very happy to learn it and apply it and find different ways to train the person. And more than once I've heard, my personal trainer said it's a lot more challenging to give me a workout now, but I'll tell you what, my workouts are so much better now because it's based on these principles. And people can only teach what they know. They can't teach what they don't know.
So for someone looking for like a personal trainer, is there like a label or something, or a title for someone who teaches the methods that you teach?
Yeah, I would highly recommend that they go to the Gray Institute's website. It's Gray Institute, Gray, and they do have a locator for people who've taken their coursework. You would want someone who's at least taken the CAFS course, which is Certification in Applied Functional Science. So it's CAFS. And if they're certified in that, they're going to know how to treat you as a whole body. They're going to make sure you're doing authentic movement, your 3-plane training. They can look at things where the culprit may be versus the victim. Yeah, they're going to be very skilled at help.
Okay. Now, I like to go a little deeper too in the questions. I'm very familiar with human anatomy as well. So I have a few questions about ATP production, because we understand that it's energy, basically, mitochondria. So are there certain foods that help increase that for someone who's maybe low on energy or anything like that?
So I will completely vulnerably admit I have not seen data that shows specifically ATP is increased with this way of eating. However, I do know that, and I've done a deep dive into so much data over the course of all those free events that I've hosted, because I always want to make sure I'm current and I want to make sure I'm accurate on what the data shows. And what I have seen is that complex carbohydrates are what the body thrives on. We need 3/4 of our calorie intake to be complex carbohydrates. I'm not talking cookies, candies, donuts, all that kind of garbage. I'm talking potatoes, sweet potatoes, lentils, beans, whole grains, those kind of things. And I know that carbs have been given this, oh my gosh, this is going to destroy my life kind of a thing. And I know there's a massive conflict of opinions out there on the whole food thing. And what I find is there's not really, I think the biggest problem people have about food is the confusion that has been created. And again, as I said, the experts I've studied under 30, 40 years, they've restored health. They've gotten people off meds. They, eliminated chronic pain. Even major AI issues, autoimmune issues like multiple sclerosis respond to changing food intake. And so,
Interesting.
yeah. So, these are, Dr. Roy Swank was well known for that. He spent decades. And then Dr. John McDougall took on his mantle and continued that. He's passed this past year. But I've seen people restore their health by changing to mostly complex carbs. Obviously, there's protein in everything, and people get so concerned about protein. And when I did protein's in bananas, protein's in potatoes. You don't have to eat animal food to get protein. I'm not saying you have to be vegan. People get scared with that V word. Oh my gosh, like you got to give everything up. That's not it. It is the fact that when you're not eating enough complex carbs because you think you have to eat more protein, then you're depleting yourself from complex carbs. And what I've seen in the data is when people aren't getting enough complex carbs, their body will use the protein they're consuming for energy during a workout because it's the only source it has. So now that protein that you think is going to help to build muscle is actually being used for energy. And it's very inefficient for the body to use protein for energy because that's not how it's designed to do it. So you really need the complex carbs, and complex carbs will help resolve delayed onset muscle soreness more quickly as well. I know some very well-known athletic trainers who trained major sports teams. I won't name names because I don't have the right to do that, but they won't let their athletes get out on the field for a practice unless they've eaten fruit, which is, they're not telling them to gang up on their protein. Right? Let's have some fruit. So, and it's the same thing with people when they're getting older. We think that age-related lean muscle loss, that's not accurate at all. It's activity-related lean muscle loss because every single study I looked at, now I'm not saying I read them all. I'm not old enough to have read every study based on that. However, everyone I read said the same thing. The subjects were sedentary. They tested them here. 12 years later, they had lost lean muscle loss. Usually it was the calf or the quad. They were looking at certain areas of the body, but they were sedentary. They weren't. And then the studies that looked at those who remained active and exercised and moved in their 80s, they had no lean muscle loss. So, yeah. So, I mean, I didn't mean to transition into that, but the whole thing about, your question about the ATP, I have seen when people are focused on complex carbs as 3/4 of their plate kind of thing, there is no lack of energy. And there's also hydration, which is huge. A lot of the times people are fatigued because they're not drinking enough water. A lot of people are drinking all these caffeinated drinks, which basically is a diuretic. So you're going to lose fluid. And when your muscles are 78% water, what happens when you're dehydrated? Your muscles aren't going to function well. You're not going to have energy. You're going to have headaches. I mean, the list goes on and on.
Right. Oh yeah.
Yeah. Yeah. So
Very interesting. Very interesting. So I want to kind of ask you, since you work with people with chronic pain, how much of a factor does inflammation play into all of this in the body?
So inflammation is huge. The body will respond. There are these inflammatory cytokines that the body will respond to food. And I had created a huge course for, it was a program that it hadn't ended up being loaded because the person in charge of the program, it was a very special documentary that was created. And then the person who was in charge of it ended up stepping away to a different position. So it didn't get uploaded. But I spent 8 months doing research for an obesity and pain course. And what I found was inflammation was one of the number one factors that was causative of the pain. And when you're carrying excess weight, those fat cells, we used to think were just, if you looked at it on a fat cell in a microscope, it would just stare back at you and it did nothing. But now we know those fat cells, 20 years later, we've learned a lot, are little factories and they produce inflammatory cytokines. And so when somebody's carrying excess weight, a lot of the times they have a lot more inflammation going on in their body. And it's not because of the weight itself. It's because of the activity of the fat cells. And the good thing is I've seen people who haven't had a chance to lose weight yet, but when they change their diet, which I'll get to in a second, they see a big improvement in joint pain and chronic pain and that kind of thing. And so food plays a huge role in inflammation. And usually it's arachidonic acid, which there's a lot of arachidonic acid in animal foods. So this is where I tell people you don't have to be a vegan, but you want to minimize your animal food intake to no more than about 10%. And obviously you can be a vegan if you want to, but you want to do it with some help and make sure you do it correctly, because a lot of people don't do it correctly and they end up with problems and they wonder why and they think it didn't work. But the animal foods will promote, it's kind of like putting a brick on the gas pedal. They will, because of the arachidonic acid, it promotes that. So, and then, so joint damage. The Stanford University School of Medicine did a study to determine what causes joint damage. And they found it has nothing to do with age, wear and tear, or gravity. It's inflammation. So, and if food and excess weight are the biggest offending factors, we have control over that. Now, I know there are some people who really struggle with weight loss, but just changing the food will help with both of those things.
I know you've noticed the trend with like Ozempic and the GLP-1s and stuff like that. So what is your opinion on that?
Yeah. So those medications have been seen. I have some colleagues who have spent, hundreds of hours studying that specific topic, and they would be much better to speak on it as an expert than I am at this point. However, what I've seen just in my own studies is that anyone who discontinues that medication is in a lot of trouble. Because now I'm working with somebody right now who was on that medication and she went off it about a year ago and she's still struggling to reset something called peristalsis, which is how food moves through the body in one direction from the time you swallow it till the time whatever you don't need exits the body. And you can hang upside down in a tree and peristalsis always goes in one direction. But peristalsis has that muscular action of moving the food through the body. That has to be at a good speed to make it simple. If it's too quick, you end up with diarrhea. If it's too slow, you end up with constipation. And obviously it will impact the nutrition that you're absorbing from your food as well. So she's still trying to reset peristalsis from having been on that medication. And so it's a bumpy ride. There is no magic pill. And in my book, Aging Culprits, I think I repeat that ad nauseum. There's no magic pill. I mean, we know simply common sense, logic. We know what we need to do. We're confused by all the noise that is conflicting. Yes. And we're looking to experts to guide us. Unfortunately, a lot of the experts out there are causing more harm than good. I mean, I'll be blunt. And I remember, I was at a conference. I was speaking for a very forward-thinking insurance company called Nice Lukens, and I was traveling around Kentucky, Illinois, and all those places, and I was with other experts who were talking on mental health and other things. And I remember people in the audience who had the surgery, right, for obesity, where you're taking part of the stomach out, or I think I have details on that in my book. There's 4 different types of surgery that people can have for that. And unfortunately, if those people don't learn how to manage their attitude toward food, then they end up gaining the weight back again, even after that surgery. And they're actually lacking nutrition because they can't eat enough nutritious food to give their body what they need. It's a vicious cycle. And so now, instead of that surgery, we've got these pills, and these pills they're basically from the pit of hell. I think they're probably some of the worst things that have been created for mankind. And I don't know, you might have some listeners who say, oh, but they helped me. But God forbid they haven't gone off them yet. That's
Yes.
where the real havoc starts.
Yeah, we have to, I think with the audience and society, we have to change our focus. We have to look at longevity. What are the long-term effects of these things? Yeah, you might feel good now, but what about 5, 10 years down the road? What is this going to do to my body? So I've actually taken the approach of eating more plant-based for myself. I was always raised to eat meat and just all this junk and crap and would just feel absolutely awful. So I've taken the approach of eating more plants, more fruit, more smoothies. I've even cut back on my dairy. So I'm trying to do the things, but I'm not looking for a quick fix or anything like that. So
Yes, yes. And the dairy, and this is another thing people like, one more thing I'm not supposed to have. And then the next expert will tell me, oh, but you need it, and so on and so forth. Again, the data
yes,
really doesn't support that dairy provides health to a human body. It's meant
I
for
agree.
the calf.
I agree.
We're the only species that consumes another species' milk.
Yeah, that's
I mean, when you
crazy.
think about it, it's really not logical. And I can tell you, from leaky gut or intestinal permeability, if you want the $1,000,000 term, dairy is one of the biggest offending factors because most people don't have what it takes to digest them because they're not a baby cow that has 8 stomachs that's meant
Yeah,
to digest that. So yeah, and I've seen a lot of people eliminate chronic pain just by eliminating dairy.
yeah. So outside of a person being raised to take these kind of products, why do you think people do it? Why do people still gravitate towards cheese? Why do people still gravitate towards
Yeah,
those things? What do you think?
cheese can be addicting, believe it or not. Only you don't need to, rob a drugstore to go buy cheese, right? It's not an illegal drug that you've got to get money for. The problem is there's something called casomorphine in cheese that makes your receptors, your opiate receptors in your brain really happy when you digest cheese. People literally are addicted to cheese and they'll say, I don't want to give up my cheese. And that's why it actually causes this addictive response in the body. So, and the dairy industry has been extremely prolific at promoting cheese. In the last 50 years, I don't think you can buy anything in a fast food restaurant that doesn't have cheese on it, including
That
tossed
is
salad.
interesting.
And even going out, my husband and I go out to eat a lot and we like a lot of ethnic foods. So we can find a lot of really healthy foods. I love Thai, Japanese, Indian, Chinese. I mean, I love every kind of ethnic food there is out there. And there's always healthy options, even Mexican. There's this beautiful this place that has this amazing vegan Mexican meal. So, and I'm not 100% vegan, but I will say that you can live without your cheese, but you've got to learn to ask no cheese, please, when you go out. Because I'll get a side dish of like sauteed spinach with garlic and it's covered in cheese, but the menu never said it was going to have cheese on it. And then I feel bad and I have to ask the server, would you mind getting this with no? I'm sorry, if the menu had said it had cheese, I would have asked for no cheese. So now I'm learning to ask, does that have cheese on it? So that I don't, have to make them redo something. But it's the dairy industry has been really prevalent at getting cheese on and in as much as possible things. So yeah.
So, what are some of the myths surrounding cravings? Like, how long does it usually take if I've been eating cheese all my life and I want to stop? How long does that take to get that craving away?
Well, most experts would say about 30 days. So one of my favorite people who talks about resetting the brain, her nickname is the brain, by the way, because she was able to help people in South Africa who had dealt with the most horrific things in history. And she was able to teach them how to learn again, how to educate. Her name is Caroline Leaf. And she was, during the apartheid and everything, she actually had protection from the people who were part of the problem. They would protect her on the way to go to these locations to teach because she was helping them learn too. So she's a fascinating woman, nicknamed the brain. But she says that it takes 21 days if you've got what she calls toxic trees in the brain. And she shows slides of how this is created in the brain cells. That takes 21 days to restore it to a healthy tree. But then she goes on to say, you want to repeat that 21-day phase for a total of 3 times if you want a permanent change. So that's 63 days, which I know, we live in the land of instant gratification. So 63
Yes.
days sounds like a really long time, but if somebody's been suffering for years, 63 days to make your brain be really happy with everything you're doing is a pretty short time frame.
Yes, I agree. Have you done a lot of research on intermittent fasting at all and how that can help?
I have done research on that. And again, that's one of those things where experts conflict. And I do know that, the autophagy and all of that people talk about, the resetting of the cells and things. I do know that there's years ago, I remember coming across a lot of data that talked about if you just ate 10% less of the amount of calories you actually require for life on a, general loose basis, you would live longer, because most of us know we're eating way too much. We're consuming way too many calories. A lot of it has to do with the fact that they're so calorie dense, the foods we're eating.
Yes.
They're very high in fat and all of that. But I think there is something to be said for giving your body a rest, for sure, from digesting. And I'll even go so far as to tell people we need to hydrate. We really do need to be drinking a lot of water. However, some people say, well, I don't like water, so I put stuff in it. Well, if you're drinking plain water, your digestive system doesn't get triggered to work because you just absorb the water. But if you put something in the water, even if it's like lemon or lime or flavoring of any kind or whatever, now your digestive system is triggered to work because it perceives it more as food. Now, that's not necessarily a bad thing, but if you're kind of overworking your digestive system with other ways, then flavored water, it's never going to get a break. So I think there is something to be said for it, but there's still a lot of conflicting expert opinion on it. So I'm kind of on the fence as far as, because I do know that a lot of the times when people starve themselves all day long, they will eat way more calories than they should at the end of the day, because their body, once they start eating, says, let's keep going, because we know tomorrow you're going to do the same thing. You're going to starve us again. So if people have an issue with food, it may not be a good idea to starve themselves all day. I know the whole point of the healthy intermittent fasting is to have an 8-hour window where you're consuming food and then the rest you're not. That may not work for everybody. I know I myself don't like going to bed if I'm starving, but
Me
I'll
either.
eat a piece of fruit. Now, fruit digests in about 30 minutes. If it's a watery piece of fruit, a banana might take 45 because there's less water, but it digests really quickly. So now you're not overtaxing your body before you try to get a good night's sleep. So there are, I think it really is kind of it depends on the person, their specific situation. And some people, if they've got medications, if they've got blood sugar issues, they've got to be really careful about fasting and that kind of thing. So I think I don't know that intermittent fasting is required to restore good health. I know way too many people who don't use that strategy, and they're living life large at a very advanced age and doing really well. So, yeah.
Is the goal to have good blood work? Like, what defines a person being healthy, so to speak, in
So,
your opinion?
well, it would depend on the current guidelines that are being presented to the physicians as far as when they should prescribe medications, because the guidelines change on a regular basis. I remember it was 15, 20 years ago when they changed the guidelines for hypertension. And immediately millions more people were being prescribed medication because now they were recommended to be medicated. That's kind of a slippery slope. It's kind of interesting how that happens. To me, I've got this thing about lifelong well-being. It means not waking up with pain. It means being able to do the things that you enjoy in life, no matter your age. It means, having free motion and having the strength to lift a grandchild or get on and off the floor, even if you're 100 years old. I mean, I've had people 100 years old doing squats in the parallel bars and getting stronger. So they nicknamed me the sergeant in the nursing home, but not because I was mean, but because I treated people based on their ability and what their goal was, not their age. And so, and saw their quality of life shoot way up because of doing the things they needed to do to get their function back or improve it. So just being able, living life in a way where you have joy. I mean, who's going to have joy if they're taking 14 meds every day and all those side effects? Or if you can't get out of a chair without feeling pain, or, you're creaking when you're moving. Or when you go to sit in a chair, you're so weak, you plop because you can't sit with control. Or you're losing your balance. You're fearful of somebody bumping into you in a crowd because you might fall. You can't restore. You don't have good stability. You might be able to pick a foot up and count to 10, but that's balance. That's not stability. If your balance gets disrupted, can you restore it without falling? That's stability. So there are a lot of things I think that equate to having a quality life. And it's not just biomarkers. I mean, do you have good relationships? Are you enjoying life? Do you have a community around you that's kind of like-minded and you can really enjoy what you're doing because you're not constantly defending what you're doing because you've got people around you who agree that that's a good thing to be doing. A lot of people, when they go to change what they're doing, they feel so isolated because everybody's kind of looking at them like, what are you doing? Or what do you mean you're no longer doing this? And why are you doing that? And they feel like they got to defend themselves. And I tell people the easiest thing when you really want to make changes and you feel like you're getting a lot of pushback from friends, coworkers, neighbors, family members, the simplest thing to say, and nobody can say anything against this. The simplest thing to say is, this seems to be working for me. So I'm going to keep doing it because it seems to be working for me.
That's
Now,
good.
who's going to say, oh, no, don't, they can't say no
Right.
to that and they'll leave you
Yeah.
alone. But
Yeah,
being in a
that's really good.
community is very helpful. Finding your tribe, so to speak, is helpful.
What I get from you too, Eileen, is like you're someone I want to follow, like moving forward. Like I want to like learn everything that you're teaching and possibly even go through your academy and stuff like that. So can you talk about your website and some of the things you're doing
Sure.
in that space?
Well, I have about 8 websites. So but they each have a very specific purpose. I have a website for each of my books. So there's a website for pain culprits and there's a website for aging culprits. And the reason for that is the publisher said if you write anything more than 200 pages, people won't read it. And I can't help them if they don't read the book. But I felt bad because there was a lot of information I wanted to put in the book that would have made it longer than was recommended. So I put it all on the website and it's free. You don't even have to buy the book to check out the resources. You can just go to those websites and you can access all the free resources that are included. So there's 2 of them. I also have one that is for my academy, and my academy is 50 plus age wise. There are some people in their 40s. And what we do is we have a live class every week where I teach them specific movements. We focus each week of the month on like stability or strength or whatever. I mean, I've had people, I got people in that academy who are in their 80s even, and we'll do like, I don't know, 80 squats in 7 minutes kind of thing. It depends on, and of course they'll modify if they need to. It's not about overworking the body. It's about working the body correctly. And so if the person's really fit, say they hike 20 miles a week in some pretty rough terrain, they still love the classes and get a lot out of them. If somebody is fairly sedentary and they're trying to get their life back, they still get a lot out of the classes because we modify as much as needed. But I also challenge people. So that's the academy, and there's a lot of other stuff in there. The private club is if somebody's got chronic pain, I would aim them at that because I've got a free level membership. And that's the one where they can check out that video. It's all free. It's like a 23-minute video, and it shows them how to move their body in 3 planes and figure out where their culprits are that they may not have realized is causing the problem, and an introduction to the movement. I think there's like 8 movements in there that are 3 plane that'll teach them how to load their calf ankles properly and all kinds of things. So that's great, but that's called MWP because it stands for Move Without Pain. So mwpprivateclub.com. So anybody in pain, that's a great way to start because it's free. And there is a paid level, of course, but the free level is there for them. And then my main website is havelifelongwellbeing.com. And I've got a little like 5-question quiz that they can answer. And that will sort of aim them to the resources that I have that will help them with what they're concerned about the most, whether it's a virtual class or YouTube videos. I have tons of free stuff available because I really do want to erase pain from the world. Obviously, some things I do need to earn a living at because I don't want to live out of my car, and I do need to keep the lights on. But I have as much free as possible so people can really kind of dip their toes in and see, hey, this works for me. Now I think it's okay for me to invest a little more time and resource in something.
One quick question, and thank you for that. I didn't get a chance to ask you, but through all your years and all of your experience, at certain age ranges, do you notice a certain type of area of the body that tends to affect that age group of people, like the knees, the elbows? Like, what do you normally see for different age groups?
Yeah. So, I mean, that's really good. I'll start with younger folks. A lot of younger people have struggled with pelvic floor function. You're seeing a lot of young teenage athletes who are not really, there are some, trampoline coaches who have their athletes pad up before they get on the trampoline. So, and I've actually, I read some data that said, well, the trampoline is causing weak pelvic floor. And I'm like, they've got it completely backwards. The trampoline is exposing a weak pelvic floor. It's not causing it. So, because, the kids are sitting a lot more now, they're doing all of their training, which is intermittent, but they're sitting and they're on their devices instead of out on their bikes, climbing trees, getting in trouble physically like I used to do. And I was always up a tree somewhere. But yeah, it's important. So younger people really need to pay attention to that, and ankle function, because a lot of young athletes have injured their ankle and they come back to me a year later. I never worked with them for their ankle because they thought they were okay to go back to play. And now they're having trouble because they're pitching softball and their shoulders off, or they're, having a hip issue or knee issue. And it's because the ankle was never completely restored. And if the ankle's not functioning right, nothing above will. It's very important. So that's the younger folks. And then as people age, what I see more often than not is there's 3 areas that tend to be culprit areas. The ankles are huge because almost everybody has a history of something going on with their ankles. If not, they might have a history of maybe they had a bunionectomy, or they had a knee replacement, or they had some other surgery or injury where they were maybe non-weight bearing for a while. So that ankle that was non-weight bearing just kind of went to sleep and never really got full function back when they started walking, but they didn't know that. So ankles are key. And a lot of older people, their ankles are very stiff because they don't work their ankles. They don't train them in 3 planes. And so if they're lacking motion, their feet are kind of pushing down, which makes them fall back. So then their upper body does this to counterbalance. And now they got this forward lean, and everybody's trying to get them to lift their head and shoulders up, but it's their ankles that need to be restored. So we really are whole bodies. So ankles are key. Hips are another one. Hips are huge, especially with all the sitting we do. The front lock's short. When you sit on your gluteus maximus, I call him Max. When you sit on Max, he gets weak, he atrophies, he shrinks, he doesn't work as well. And so now you've lost your power source. You struggle to push open a door, and it's because of Max. And then the trunk. The trunk is huge at losing function as people get older because people don't train their trunk. And if you struggle to back up your car because of neck pain or back pain, I can almost guarantee you it's trunk motion that's been lost. So, and there's some beautiful ways to restore that. Very simple to do.
Yeah, this has been really awesome, Eileen. I love your spirit, number one, like your energy. And you also have a YouTube channel as
I
well.
do. Yes.
So I'm going to subscribe to that. Can you tell the audience how to find you?
Yeah, just type in my name, Eileen Kopsaftis, when you go to YouTube, and it should come up. Yes, I've got,
Okay.
I don't know how many videos on there now. I send out a Friday value video every week to subscribers who subscribe to my newsletter, which is monthly. And it's like 3 to 5 minutes. And then I've got the long form videos where I talk about, why does your neck hurt when you walk? Or why does your back hurt when you stand up? Or, things you definitely don't want to do in a gym that's going to almost guarantee you have knee injury and pain and problems. So there's a lot of videos on there, and I will be posting more consistently very shortly.
Do you also have any literature or books that you recommend that people should look into for 2026 or anything?
Well, mine, of course, but not because I'm self-promoting,
Yes.
but
Yes,
because
absolutely.
there's a lot of great information in there. Some of my favorites, if people really want to delve into the whole nutrition aspect, one of my favorite authors is T. Colin Campbell, and he wrote the China Study, which is,
I have that.
yes. He also wrote Whole, WHOLE, because he talks about how we want to define nutrition down to these little tiny parts. And I've seen us do the same thing with human function. So we don't want to do that. Oh my gosh. If somebody's concerned about diabetes, Dr. Neil Barnard has written a fabulous book on how to reverse diabetes. He talks about the real cause is intracellular fat. It's not sugar.
Interesting.
And he packs it with data. He actually was responsible for a study that showed diabetic neuropathy could stop with changing your diet. And diabetic neuropathy is extremely painful.
Yes.
So that's, anybody with diabetes, anybody who's concerned about heart disease. My favorite book is by Caldwell Esselstyn, Prevent and Reverse Heart Disease. That is a fabulous book that will teach you pretty much everything you need to know about the basics and how to get started and what to do. Yeah, I could go on and on, but I think that's a good start.
Yeah. That's a really good start. And lastly, have you dealt with anyone with sickle cell before?
I have not. So I wouldn't be able to speak on that, but now you got me curious. I mean, I know it is a response of the body that has not really been able to be handled well medically. So, but I'd be curious if there's any of the icons in my world who've looked into that. So now you got me curious, Trey. I'll have to.
Hey, it's exploring places unknown. Okay.
Check it out. Yes.
I've treated patients with sickle cell, and our protocol is usually pain management on the acute level. But I was always curious, like, is there a way to like help this long term? Because it kind of comes out of the blue.
Yeah, there's a lot of things. Ehlers-Danlos syndrome, ELS. That again, with those people, with us, it's more pain management, and yeah. Unfortunately, there's a lot of things out there, but I don't know that any of the people that I know who've done research and worked for decades with people on diet change and what causes it. I don't know if that particular issue has ever been tested as far as making rapid changes. I do know that there's a place called True North in California, and it's led by Alan Goldhammer, and for some reason his name is not coming to me, so I apologize for that. But it's the only medically supervised fasting facility in the country. They've been around for decades. They've never had an adverse event reported. They're very good at what they do. My oldest daughter went there because she was diagnosed with rheumatoid arthritis. And I will never forget, it was about 8:30 in the morning, and I was going to be speaking for that insurance company I was talking about earlier at 9. And so when I saw my phone ring and it was my daughter and I knew she was at True North, I answered. I went out in the hallway and she's crying. And I'm like, what's wrong? And she said, it's the first time my feet have hit the floor in over a year and I haven't had pain. And so she goes, it's the food. So she was able to literally a few years later, she is diagnosed completely free of RA. She has no body markers of RA in her body at all. So I don't know if that might be a good research thing. Call True North and see if they've ever worked with anybody with sickle cell. I'd be curious.
Yeah. Okay. This is fascinating. And we're going to end here shortly. What would you say to someone that's going to be listening, as it pertains to 2026, what would you say to them? Because I know you're a wealth of knowledge. What would you say to them that kind of get them started on this journey?
Well, I think the most important thing is for them to know that there is always something you can do. No matter what your circumstance, no matter what you're facing, there's always something you can do that can make things better. Always. The trick is finding the right person to help you. But I've seen so many people who come across me who they're like, I wouldn't have been ready to do any of this a year ago, but now I am. And now I know why I just met you. That when we're ready, the teacher will come kind of thing. But I think the most important thing for them to know is don't just blindly accept the narrative that we're being fed, because the human body heals. The human body is phenomenal. And the medical world doesn't have all the answers. And more often than not, they're causing more harm than good. And I'm not attacking them, but as we already talked about, manipulating things, the side effects can be horrific, like we talked about with the Ozempic and all that, going off it. Oh my goodness. So I'm 67. I don't even have Tylenol in my medicine chest. I take no medications. I have no diagnoses. And I'm not an outlier. I'm not an anomaly. I do the right things the right way most of the time. I'm not perfect. If you try to be perfect, you're going to be a high anxiety person and you're going to be living in the run from the bear mode, which is not healthy. So, you've got to enjoy life. You have to do things that you enjoy that may not be the perfect thing to do, but 90% of the time, if you're doing the right things the right way, you can live life large and you can get your life back. I've seen so many people get their life back by doing that, no matter how old they are.
Yeah. Thank you, Eileen. This has been amazing. I'm fired up. I'm going to check out everything that you're offering on your websites. Eileen, I'm going to include all of your information in description. So I hope that people will reach out to you. I'm gonna check out your YouTube and everything. So thank you for what you're doing.
Yes. Yes. Thank you, Trey, for having me. And if you have any questions, I'm just an email away, or you've got my number. We can call.
Okay. All right. Well, I wish you the best for 2026, and we'll catch you guys on the next episode of Exploring Places Unknown. Bye bye.